62% of adults over 70 notice their ankles swell by the end of the day. They blame it on standing too long. They blame it on the heat. They blame it on salt. Your doctor checks your weight. Your doctor checks your blood pressure. Your doctor listens to your lungs. But almost nobody presses a thumb into your ankle and counts how long the dent stays. That simple test takes 3 seconds, and it can predict heart failure up to 5 years before you feel any chest pain. I'm Dr. Garrett Thornton, 34 years in internal medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. It is 6 o'clock in the evening. You sit down in your recliner after dinner. You pull off your shoes and notice something. The sock line is deeper than usual. Your ankles look puffy. You press your thumb into the skin above your ankle bone, and it leaves a dent that stays for a few seconds. You have noticed this before. Maybe for months. Maybe for years. You mentioned it once at a checkup, and your doctor said to cut back on salt and put your feet up. That was the end of the conversation. But your ankles are trying to tell you something your doctor did not have time to explain. The myth most people believe is that swollen ankles after 70 are just a normal part of aging. They are not. Mild puffiness can happen with prolonged sitting or standing. That is gravity. But persistent swelling that leaves a dent when you press it, called pitting edema, is different. That means fluid is accumulating in your tissues. And the most common reason after 70 is that your heart is not pumping efficiently enough to pull fluid back up from your legs. This is not a heart attack. This is the slow, quiet weakening of your heart muscle that doctors call heart failure with preserved ejection fraction. Your heart still squeezes. It just does not relax properly between beats. And it is the most underdiagnosed form of heart disease in seniors. Your heart pumps blood out to your body and then pulls it back. Think of it like a water pump with 2 jobs. Push water out through the hose and suction it back into the tank. After 70, the suction side starts to weaken. Blood pools in the lowest point of your body, your ankles, your feet, your lower legs. Fluid leaks out of your blood vessels into the surrounding tissue. That is the swelling you see. In the early stages, it comes and goes. Worse at night, better in the morning. But as the heart weakens, the swelling stays longer. Eventually, it stops going away at all. The fluid can also back up into your lungs. That is when you start feeling short of breath lying flat, or waking up gasping in the middle of the night. By that point, the damage is advanced. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Harold. Harold was 76 years old, retired electrician from Pittsburgh, Pennsylvania. His wife noticed his ankles were swelling every evening for the past year. Harold said it was just from being on his feet all day in the garden. He went to his annual physical. Blood pressure was 148/90. Doctor said to cut back on salt. Cholesterol was fine. Blood sugar was fine. Nobody checked his ankles. 6 months later, Harold woke up at 3 in the morning gasping for air. He could not breathe lying flat. His wife called 911. At the hospital, they diagnosed him with heart failure. The cardiologist told Harold this had been developing for at least 3 to 4 years. The ankle swelling was the first sign. If someone had done a simple BNP blood test or an echocardiogram a year earlier, they could have caught it before the fluid reached his lungs. Here is your first test. Right now, take off your shoe and sock on one foot. Press your thumb firmly into the skin just above your ankle bone on the inner side. Hold it for 5 seconds. Release. If the dent stays visible for more than 3 seconds, that is pitting edema. Grade it. If the dent disappears in under 5 seconds and is less than 2 millimeters deep, that is grade 1, mild. If the dent is 2 to 4 millimeters deep and takes up to 15 seconds to disappear, that is grade 2. If the dent takes longer than 30 seconds to go away, that is grade 3 or 4. Anything grade 2 or higher needs a doctor visit within the week. Here is your second test. Measure the circumference of both ankles with a soft tape measure first thing in the morning. Write the numbers down. Measure again at 8 in the evening. If either ankle is more than 1 centimeter larger in the evening than it was in the morning, you have significant fluid shift happening. Do this for 3 days in a row. If it is consistent, bring those numbers to your doctor. Doctors respond to data. A patient who walks in with 3 days of measurements gets taken more seriously than someone who says, "My ankles seem puffy sometimes." Things that make ankle swelling worse and mask the real cause. First, sitting in a recliner for hours. The recliner feels good because it elevates your feet, but it also means you are not moving. Movement is what pushes fluid back up through your veins. Second, too much salt at one meal. A single restaurant dinner can add 3,000 milligrams of sodium. That pulls water into your tissues within hours. Third, calcium channel blockers. Amlodipine is the most prescribed blood pressure drug in America, and ankle swelling is its #1 side effect. Many doctors add a diuretic to treat the swelling instead of switching the medication. That treats the symptom, not the cause. Fourth, skipping compression socks because they are uncomfortable. Modern compression socks are not the thick beige stockings from 20 years ago. Knee-high 15 to 20 millimeters of mercury compression socks are available in every color, and they make a measurable difference. Here is what helps. First, walking for 10 minutes after every meal. Not a workout, just moving. Calf muscles act as a pump that pushes blood and fluid back up toward your heart. This single habit reduces evening swelling by up to 40% in most people. Second, compression socks. Put them on first thing in the morning before swelling starts. 15 to 20 millimeters of mercury for mild swelling, 20 to 30 for moderate. Available at any pharmacy for about $15. Third, potassium-rich foods. A banana, a baked potato with the skin on, or a cup of plain yogurt. Potassium helps your kidneys flush excess sodium and fluid. Fourth, sleeping with your feet elevated 6 inches above your heart. Use a pillow under your mattress at the foot of the bed, not under your ankles. This lets gravity drain fluid all night. This is the Thornton ankle protocol. Step 1. Do the thumb press test weekly. Track your ankle measurements morning and evening for a baseline. Bring any changes to your doctor with the numbers written down. Step 2. Ask your doctor for a BNP blood test. This measures a protein your heart releases when it is under strain. A normal BNP is below 100. Above 300 usually indicates heart failure. This is a simple, cheap blood test that can catch heart failure years before it becomes an emergency. Step 3. Walk 10 minutes after every meal and wear 15 to 20 millimeters of mercury compression socks daily from morning until bedtime. Harold followed this protocol after his hospital stay. He wore compression socks every day. He walked after meals. His cardiologist started him on a low-dose diuretic and an ACE inhibitor. Within 4 months, his ankle swelling was down by 70%. He has not had another breathing episode in over a year. He told me he wishes someone had explained the ankle test 5 years earlier. Write your age below. And tell me honestly, do your ankles swell by the end of the day? I read every comment. Here are your 5 takeaways. 1. Persistent ankle swelling after 70 is not normal aging. 2. The thumb press test takes 3 seconds and can reveal pitting edema. 3. Ask your doctor for a BNP blood test to check heart strain. 4. Walk 10 minutes after meals and wear compression socks daily. 5. Measure your ankles morning and evening and bring the numbers to your doctor. I made this channel for one reason: the information your doctor knows but does not have 12 minutes to explain. I don't sell supplements. I don't have a clinic. I profit from you not needing me. If this helped you understand what your ankles have been trying to say, it was worth making. I'll see you in the next one.